Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes of urethra pain and treatment options. Urethra pain may be caused by many underlying conditions, including sexually transmitted infections, STIs, prostatitis, local irritation from soaps or spermicides, and urinary tract infections, UTIs. Menopause can sometimes lead to vaginal dryness, which may also contribute to urethra pain. /r/n/r/n Urethra pain often feels like a burning sensation. And since the urethra is the tube through which urine passes from the bladder to the outside of the body, it can make peeing very uncomfortable, sometimes even excruciating. /r/n/r/n The urethra is the tube running from the bladder to the outside of the body. The structure and function of the urethra is different in biological males and females. These differences can play a role in the conditions that lead to urethral pain. /r/n/r/n Urethritis is a medical term that means inflammation of the urethra. This inflammation may be caused by /r/n/r/n Possible STIs that can cause urethritis include /r/n/r/n Reactive arthritis. Reiters syndrome is another potential cause of urethral pain. Infections of the eyes, urinary tract, and genitals often accompany this type of joint pain and inflammation. These co-infections can include /r/n/r/n UTIs often cause urethral pain, but they are much more common in females, due to the short length of the urethra. Up to 60% of females will have a UTI during their lifetimes. /r/n/r/n The pain of a urinary tract infection could feel sharp or burning. In addition to urethral pain, people may experience /r/n/r/n Interstitial cystitis is a poorly understood condition and the cause is unknown. The severe urethral pain mimics a bad UTI, but urine cultures don't show an infection. It's thought by some to be a systemic, bodywide condition rather than a localized infection. It is often associated with other conditions such as fibromyalgia. /r/n/r/n Anything that blocks the urethra can lead to the buildup of urine. This buildup stretches the tissues, causing significant urethral pain. There are many potential causes of obstruction, including /r/n/r/n Urethral obstruction may back up urine into the kidney, resulting in kidney damage, hydroureteronephrosis. Chronic urinary tract infections, especially pyelonephritis, may also lead to kidney disease. /r/n/r/n Some medications, such as procardia, nifedipine, can irritate the urethra and cause pain. Radiation therapy may also result in chronic pain, radiation cystitis. /r/n/r/n There are some bladder irritating foods, as well, that may irritate the urethra and cause pain. Common culprits include /r/n/r/n Damage to the urethra can lead to pain. Examples of trauma include /r/n/r/n Some non-infectious skin conditions, when present near the opening of the urethra, may cause pain. A few of these include psoriasis and lichen sclerosis. /r/n/r/n Benign prostate hyperplasia can lead to narrowing of the urethra and cause pain. /r/n/r/n Other conditions that may result in urethral pain include /r/n/r/n Urethral irritation may also be due to /r/n/r/n Yeast infections are another common cause. These fungal infections can cause significant discomfort and itching. /r/n/r/n Bacterial vaginosis is yet another cause related to the vagina. This infection can be very frustrating due to its often chronic nature. Symptoms include vaginal discharge and a fishy odor. /r/n/r/n In those who are menopausal, vaginal atrophy can lead to urethral pain, vaginal pain, and dryness. When severe, the urethra can push out of the urethral opening, urethral prolapse. Vaginal atrophy can also increase the risk of UTIs. /r/n/r/n Diagnosis of urethritis starts with a careful medical history. Your healthcare provider will ask you about any possible risk factors for STIs, such as a new sexual partner or condomless sex. They will also ask about any urological problems you have had in the past. /r/n/r/n Your healthcare provider will then perform a physical exam. They will look for urethral discharge, ulcers, and enlarged inguinal lymph nodes in the groin. Additionally, they may gently milk the penis by pulling down the shaft to check for discharge. /r/n/r/n Your healthcare provider may also examine other areas, such as the scrotum, cervix, anus, and throat, for signs of inflammation. Depending on the results, they may order further tests or recommend a referral to a urologist. /r/n/r/n Lab tests to evaluate urethral pain include a urinalysis. This test looks for /r/n/r/n Screening guidelines for STIs include tests for the major STIs such as gonorrhea and chlamydia. If your healthcare provider suspects a yeast infection, they will also do a co-prep test. Tests for STIs may involve /r/n/r/n Your healthcare provider may do a urine culture to determine if an infection is present. This test identifies the type of bacteria present and its sensitivity to antibiotics. This knowledge helps determine the specific antibiotic that will be most effective in fighting the infection. /r/n/r/n Other lab tests may include /r/n/r/n Imaging tests are typically not used to evaluate urethritis. However, it may be necessary if your healthcare provider suspects a kidney infection, pyelonephritis, or kidney stones, or if there is a significant amount of blood in the urine. /r/n/r/n More often, imaging tests look for complications of STIs, such as an abscess in an ovary or a fallopian tube. /r/n/r/n A cystoscopy is a test that involves inserting a narrow lighted tube into the urethra and bladder. It may be done to /r/n/r/n Sometimes, if there is scarring and strictures, your healthcare provider may need to open the urethra to relieve symptoms. /r/n/r/n If your healthcare provider suspects that a mass is causing a urethral obstruction, they may order a pelvic computed tomography (CT) scan to get a better look. /r/n/r/n In addition to the conditions noted above, several medical conditions may lead to urethral pain. These include /r/n/r/n The treatment of urethral pain depends on the underlying cause. Common treatments include /r/n/r/n Fortunately, there are simple measures you can take to prevent the more common causes of urethral pain. Safer sex practices can help reduce your risk of STIs. You can make sex safer by /r/n/r/n Tips for reducing the risk of urinary tract infections include /r/n/r/n It is never normal to have pain in the urethra. A healthcare provider should always evaluate this symptom unless it has a clear, reversible cause, such as stinging immediately after using a new personal care product. That said, some conditions are more urgent than others. /r/n/r/n You should see your healthcare provider right away if you have /r/n/r/n Even if your symptoms are mild or come and go, it's still essential to make an appointment. /r/n/r/n Untreated infections with chlamydia and gonorrhea can permanently damage reproductive organs. Even in the absence of symptoms, this can lead to long-term complications. /r/n/r/n Urethral pain may be caused by many things, including STIs, trauma, bacterial or fungal infections, and obstruction. To accurately diagnose what is causing pain in your urethra, your healthcare provider will do a physical exam. They may also order labs and imaging tests. /r/n/r/n Treatment depends on the cause and may include antibiotics, antiparasitics, antivirals, or symptom management. Urethra pain is never normal. If you have pain in your urethra, be sure to see your healthcare provider. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.